Welcome to this complete guide on Crohn's disease, covering its history, epidemiology, clinical complexity, and the future of care. Crohn's disease is a chronic, immune-mediated, transmural inflammatory bowel disease that can affect any part of the GI tract. Cellular pathology involves a breakdown in the balance between inflammatory and non-inflammatory macrophages. Historically, cases of intestinal inflammation were noted as far back as 1769. The pivotal event was the 1932 Mount Sinai publication, which detailed regional ileitis in 14 patients, leading to the disease's current name. Global epidemiology shows 4 stages. Incidence accelerates in newly industrialized nations, linked to urbanization and Western diets, while prevalence compounds in early industrialized regions. Peak onset for Crohn's disease occurs between ages 15 and 35. Risk factors form a nexus of genetics, environmental triggers like pollution and diet, and a severely imbalanced gut microbiome. Intestinal symptoms include chronic diarrhea, severe abdominal pain, and structural complications. Extraintestinal symptoms include crippling fatigue, arthritis, and eye inflammation. Differentiating Crohn's disease, CD, from ulcerative colitis, UC, is key. CD can occur anywhere in the GI tract, is transmural, and features skip lesions, while UC is colon-isolated, mucosal, and features continuous inflammation. The diagnostic pathway begins with symptom presentation, followed by biomarkers like fecal calprotectin. Cross-sectional imaging helps map damage, and ileocolonoscopy with biopsies remains the gold standard for confirmation. The personal cost of Crohn's disease is significant. Physical burdens include chronic pain and malnutrition. There is also a hidden mental health burden, including an elevated suicide risk in young patients. The public cost includes visible direct costs, approaching $50 billion annually in the U.S., driven by biologics and surgeries. Submerged indirect costs involve billions lost to absenteeism and early departure from the labor workforce. Treatment has evolved from the step-up model, which waited for bowel damage before using advanced therapies, to the top-down modern model. This new model mandates early use of highly effective therapies to target deep mucosal healing. Current pharmacological treatments follow 2026 AGA guidelines. This involves first-line advanced therapies, targeted small molecules, and combination strategies to achieve steroid-free remission. Surgical treatments are not curative, but address complications. These include bowel resections, strictureplasty to widen narrowed segments, fistula repair, and abscess drainage for severe infections. Future research focuses on AI for predictive modeling and personalized treatment. Other areas include precision diet and environment interventions, and next-generation molecular targets, like refined cytokine pathway inhibitors. The future model of care centers on the IBD patient-centered medical home, moving to proactive, integrated teams. A key imperative is health equity, ensuring global access to high-cost biologics. This video's content is informed by research published in gastroenterology journals, including new practice guidelines and studies on the disease's global evolution and cost.